Hello, my name is Connie Badanas. I am calling from Medicare Hospital. May I speak with Miss Florian May Domingo, please?
Hello, good morning. Yes, speaking.
Ma'am, I'm calling to collect some follow-up information regarding your recent lab test result. Before we begin, I just want to confirm your date of birth and address. Could you please share those with me?
Yes, I was born on November 13, 2002, and I'm from Barangay Tumarbong, Rojas, Palawan.
Okay, ma'am, November 2002 and Tumarbong, Rojas, Palawan. Okay, ma'am, all of the information we talk about will be kept confidential and only people who need to know will have access to it. The information is only used to help us to stop the spread of COVID-19 and make sure that you are healthy. Everything is entered into a highly protected database. Is it okay if I continue?
Yes, continue.
Ma'am, may I ask if you already know or does someone already told you about your SARS-CoV-2 test result?
No, there's no one who told me about that.
Okay, ma'am. I am calling to inform you that your result of your SARS-CoV-2 test came back positive. How do you feel about it, ma'am?
To be honest, I really don't know how to express what I'm feeling right now because I'm too shocked that I'm a COVID positive because I always follow all the health protocols every time I go out.
Okay, ma'am. I understand how you are feeling right now. Ma'am, I would like to follow up your diagnosis with COVID-19. I also want to go over next step in taking care of yourself and preventing infection in others. I will ask a number of questions and get all information that is needed to best determine how we can help you. Question I will ask will cover some basic information about you and the contacts you may have had since you become sick. Is it now a good time to talk?
Yes, ma'am.
Okay, we will get started. You can feel free to stop me at any time with question or if you need to get off the phone. Ma'am, I would like to tell you how COVID-19 spreads. It spread through the close contact with a person who is infected with the virus that causes COVID-19. Sometimes it is spread of a short time through the air when an air-affected person cough or sneezes. Ma'am, do you have a cough, a fever, squeezing, cold, diarrhea, dizziness, or vomiting?
Yes, I have a cough, fever, cold, and I also experience vomiting.
Ma'am, may I ask the dates of each symptoms started? Ma'am, may I know when your cough started? How about your fever, ma'am? Your cold, ma'am? Okay, ma'am. Your vomiting? Okay, ma'am, it started just yesterday. Okay, ma'am. Ma'am, do you have a healthcare provider?
No, I don't have health provider.
Ma'am, may I know what your test done? Where was your test done and what date was it done?
My test done 3 days ago at Medicare Hospital.
Okay, ma'am. Do you have any other current medical condition?
No, I don't have.
Assure you that we will not release your name to your contact and you are not required to personally notify them of their potential exposure. It is very important to let your household contact know that they should stay home and quarantine for 14 days from the date of their last exposure to you. Ma'am, I would like to collect information on anyone who have been in close contact or in proximate contact with beginning 2 days prior to your onset of illness up until you started the self-isolation. Start with people who live with you. Please tell me the name of people who have been living with you beginning 48 hours before you started feeling sick.
Hey ma'am, for now I was living with my parents, Maricel Domingo and Judito Domingo, and their contact number is 0975-7835-149. I was also with my two siblings, Clint Ivan Domingo and Jeep Ian Domingo, and they don't have a contact number.
Okay, ma'am, let's turn our attention to where you were 48 hours before you became sick. Again, I want to assure you that we will not release your name to your contacts and you're not required to personally notify them of their potential exposure. Did you work outside the home this time, ma'am? If so, If so, please tell me about any coworkers you work with those days and their contact information.
Ma'am, for now, I don't have a work.
Okay. Were you any place else within 48 hours of becoming sick?
1, 2, 3, go. 3 days ago, after I went to the hospital to have some test, I went to the market to buy some goods.
Okay, ma'am, may I know which market it is and the vendor which you buy your goods?
That market was in Barangay Tumarbong and the vendor's name is Helen Villacarillo.
Okay, ma'am. Ma'am, do you have a contact with her? And may I know any customer that you've encountered there?
I'm sorry, I don't have contact with her and I didn't encounter any customer there because it was already night.
Okay, ma'am. And did anyone visit your home within 48 hours of becoming sick?
Yes, one of my friends visited me yesterday in our home.
Okay, ma'am, your friend visited you. Ma'am, may I know what is your friend's name and do you have a contact information with her?
My friend's name is Fredeline Validor and her contact number is 0905-641-5467.
Okay, ma'am. Thank you for that. Ma'am, did you go grocery shopping? Run any errands? Meet up with friends? Stop at the coffee shop? Gas station? Bank? Childcare? Okay, no, ma'am. None over there. Did you go to church, ma'am?
Yes, on Sunday morning, I go to church.
Okay, ma'am. May I ask how you got there and who were you with?
I was the only one who went there with my car, ma'am.
Okay, ma'am. Thank you. Tell me about what you did 2 days before the symptoms onset, from morning, afternoon, and in the evening, ma'am. And also, 1 day before the symptoms onset, from morning, from after to afternoon and evening too.
Days before the symptom, I just stay at home in the morning to afternoon, but in the evening, I go to the party with my friends. And 1 day before the symptom, I can't remember that I go anywhere because I just stay at home.
Ma'am, since you are positive for COVID-19, it is very important that you stay at home and distance yourself from others so that you don't pass the infection to anyone else. So you will be required to isolate. That means to stay at home until you're fever-free for 3 days and 10 days after your symptoms first appeared. You will also be required to monitor your symptoms for the days you are in isolation. Now, I am going to discuss how you should self-isolate to protect others in your household from exposure. Mom, you should stay in one room away from others as much as possible. Use a separate bathroom. Stay at least 6 feet from others and wear a face mask if you are around others. Sleep in a private room with the doors closed. Have foods prepared by others and delivered to your door. Bag any garbage and leave it outside your door for pickup. Have someone else take care of your pets if possible. You may need to have someone else to do your laundry. And also, ma'am, prohibit visitors who do not have an essential need to be in there at home. You are also allowed to walk outside of your house on your property, but you should remain 6 feet away from others and wear a mask. You should not leave your property, home, or apartment except to the medical care. Do not visit any public areas, ma'am. Ma'am, please let me know if you have any concerns about being able to self-isolate. It is important that you work together to prevent the spread of illness. How do you feel about these guidelines? Do you anticipate any challenges in following these guidelines?
No, I think I can follow all the guidelines and I'll be able to self-isolate.
Okay, thank you, ma'am. Ma'am, as I said, you need to be monitored during the time you will be on isolation. We will be calling you daily for the next 14 days and will ask you about how you are doing, your temperature, any symptoms, and any needs. And ma'am, may I ask if you have a working thermometer there?
No, I don't have.
Okay, ma'am, since you don't have a working thermometer, I'll just notify the community support specialist so that they can provide you one.
Thank you. Okay, thank you, ma'am.
Okay, ma'am, as we discussed, you need to isolate for at least 10 days from when you started to feel sick because you will not be able to go in public, I want to ask if you think you will need help with supplies or resources during this time. For example, is it important that you have enough food for the last list next week? Will you need any medications delivered to you, ma'am? Do you have enough cleaning or household supplies available? Do you need any assistance taking care of your pets or children whom you are primary caregiver? Do you need a caregiver to help you with your daily activities?
Yes, I think I need someone to deliver my medications and foods, and I also have enough cleaning and household supplies, and also I don't have pets and children.
Ma'am, please let me know if you feel unsafe in your home. Now, we can also arrange for you to talk with a trained professional if you are feeling anxious or depressed. Ma'am, I am glad that you feel well enough to be at home at this time. However, I want to be sure that we have planned in case you start to feel worse and think you need to see a doctor. If you feel that you need immediate emergency medical care, do not hesitate to call 573-888. In addition to telling you the operator about your emergency, you should tell the operator that you have been diagnosed with COVID-19. Some signs of emergency include trouble of breathing, persistent pain or pressure in the chest, new confusion, bluish lips or face, bad injury or other emergency not related to COVID-19. Ma'am, may I ask again if you have a healthcare provider, and do you know how or are you able to get in touch with him or her? Do you have a health insurance, ma'am?
No, I don't have insurance provider.
Okay, ma'am, I am going to refer you to a community support specialist who can help you find a healthcare, insurance coverage, or a care without a charge. Thank you very much for your time, ma'am. The information you've shared is very helpful in keeping you safe, protecting those around you, and understanding the disease. Do you have any questions for me, ma'am?
No, I don't have any questions. Thank you.
Ma'am, here is a number you can call or the website with the information we have just discussed. Ma'am, if you have any questions later, you can call this number and ask me. Ma'am, I will call again tomorrow around 9 a.m. to check and monitor your condition. Is it okay to you, ma'am?
Yes, it's okay with me.
Okay, thank you very much, ma'am. Stay safe and goodbye.